Welcome to Dr. Mai, sharing medical knowledge. In today's episode, we're going to dive deep into the world of visceral pain, exploring what it is, how it feels, and why your body might be signaling something is wrong. If you haven't already, make sure to subscribe to our channel, like this video, and comment below. Your support helps the channel grow, and it allows us to bring you more informative content like this. What is visceral pain? Visceral pain originates from your visceral organs, the major organs located in your chest, abdomen, and pelvis. These include critical systems such as your heart, lungs, digestive organs, bladder, and reproductive system. When something goes wrong with any of these organs, such as an injury, infection, or a health condition, your body sends signals in the form of pain to alert you. However, the nature of this pain is different from, say, the sharp pain you might feel from a paper cut. Visceral pain is often dull, deep, and spread out. It's not always easy to pinpoint where it's coming from, but there's no mistaking that something inside you feels off. What does visceral pain feel like? Describing visceral pain is often tricky because each person experiences pain differently. What might feel mild to one person could be excruciating to another. However, in general, visceral pain is felt deep inside your body, often in the torso, and tends to be more aching and dull than sharp. Here are some common ways people describe visceral pain. Deep and hard to locate, crampy or achy, gnawing or squeezing, persistent pressure. Unlike some other types of pain, visceral pain tends to feel spread out, making it challenging to pinpoint the exact source. Your brain may only be able to identify the general region, such as your chest, abdomen, or pelvis. Where is visceral pain felt? One of the most distinctive aspects of visceral pain is how vague it feels. Instead of the pain being clearly localized, visceral pain can feel scattered across an area. For example, if your stomach is in distress, you might feel pain in your entire abdomen or even in your chest. Sometimes, your brain misinterprets the signals from your visceral organs, causing what's known as referred pain. In this case, the source of the pain is in one organ, but you feel it somewhere else. For example, a person experiencing a heart attack might feel pain in their jaw or left arm rather than in their chest. Visceral pain and somatic pain. It's important to differentiate visceral pain from somatic pain, which is the type of pain we experience from injuries to the skin, muscles, joints, and bones. Somatic pain is usually sharp and easy to locate. For example, you know exactly where a paper cut is because of the concentrated nerves in your skin that detect and relay the sensation to your brain. Visceral pain, on the other hand, is more diffuse. There are fewer nerves in your visceral organs, so your brain has a harder time pinpointing the exact location. Imagine the difference between a sharp paper cut and a stomach ache. A paper cut stings sharply at the exact location, while a stomach ache feels like dull discomfort spread across your abdomen. Symptoms that accompany visceral pain. Alongside visceral pain, you may experience other non-specific symptoms, which can make it harder to diagnose the underlying issue. These include nausea and vomiting, pale skin, sweating, changes in heart rate, body temperature, or blood pressure. Many people with chronic visceral pain may also experience mental health conditions like anxiety or depression. While it's not entirely clear how these conditions are connected, researchers suggest there's an overlap between the physical and psychological aspects of pain. For example, people with anxiety often describe their stomach discomfort as a churning sensation, while those with depression may describe their pain as an emotional anguish deep inside. Examples of visceral pain. Here are a few examples of conditions that can cause visceral pain. Menstrual cramps during periods, urinary tract infections, causing pain in the abdomen, pelvis, or lower back. Crohn's disease causing a sensation of pain or fullness in the digestive tract. In these cases, the pain you feel is a result of changes in your visceral organs due to infection, inflammation, or even normal bodily processes. What causes visceral pain? Visceral pain happens when your nervous system detects changes in your visceral organs. This may be due to increased pressure inside an organ, an extreme change in temperature, a chemical change that indicates inflammation. These changes trigger nociceptors, which send signals to your brain. Because visceral organs have fewer nociceptors, the pain feels dull and spread out, unlike the sharp, pinpoint pain from injuries to areas with more concentrated pain receptors, like your skin. Conditions that cause visceral pain. Many conditions affecting the heart, lungs, digestive system, and reproductive organs can lead to visceral pain. Some common causes include appendicitis, bladder inflammation, bowel obstruction, cholecystitis, endometriosis, heart attack, indigestion, kidney infection, pancreatitis, stomach ulcers. How is visceral pain treated? The key to treating visceral pain is addressing the underlying cause. Pain is your body's warning system, signaling that something needs to be fixed. Ignoring it or masking it with painkillers can sometimes hide the real problem. Treatments may include 1. Medications. Over-the-counter pain relievers like ibuprofen or acetaminophen. Prescription drugs like gabapentin or pregabalin for nerve pain. In severe cases, opioids may be prescribed, but only under close supervision due to their addictive nature. 2. Injections. If pain is not relieved with medication, injections of lidocaine or capsaicin directly into the tissue may help. 3. Therapy. Physical therapy to help with movement and function. Psychotherapy to manage the psychological impact of chronic pain. Acupuncture and other alternative treatments may provide relief for some patients. Final thoughts from Dr. Mai. Visceral pain can be a sign that something important is happening inside your body. Whether it's an infection, inflammation, or injury, it's crucial to pay attention to the pain signals and work with a healthcare provider to determine the root cause. Thanks for joining us today to learn about visceral pain. If you found this information helpful, please subscribe to our channel, like this video, and comment below. Your engagement helps us continue sharing medical knowledge that could make a difference in your health journey. Stay informed, stay healthy, and see you in the next episode. Don't forget to subscribe to Dr. Mai, sharing medical knowledge, like, and comment to support our channel's development and to suggest more great topics. Thank you.